Yeah, I mean, I think that's a huge issue, and it varies. And I mean, I think that's the real challenge.
State by state.
State by state, it varies. I'm developing conspiracy theories around the people who actually, the big firms that are developing these platforms that seem so complicated and expensive to fix, and seem designed not just to make the programs inaccessible, but the process humiliating. And so it's a huge issue, and it really does vary state by state. I think what's exciting is that you have seen, and the AARP Foundation can't take credit for this, other foundations have come in and provided grants and supports to willing state governments to really streamline those applications. And that's another area that has, I think, real potential. One of the things that, and I'll admit this was a shock to me when I came into this job, I worked internationally most of my career, so this is my first time really engaging in the US market. And I was sort of surprised to learn that philanthropy funds government or gives grants to help governments. In my mind, government had all the money, and they would just do things. And so we're doing some work helping states fix Medicaid ex parte renewals, and ensure that more people aren't automatically kicked off their Medicaid for procedural reasons, and finding out about that at the hospital. So there's a lot of upstream work that can happen, and we're experimenting and trying to figure out where we can have the biggest impact.